It is important for you to know that the dislocation of your hip prosthesis is more likely to occur within the first 3 months after surgery. Your therapist will show you leg and body positions that you are to avoid for the rest of your life. One of the general hip precautions for life is to avoid having your leg behind you and rotate it out. This can happen if you hyperextend your leg behind you and rotate your toe out to the side. Examples of how this could happen is if you're standing somewhere and you decide you want to reach something off of a shelf and you rotate, leaving your leg behind, you can get into that position. Another way this can happen is if you were sitting on a high surface, a chair like this, and you got down and your leg was behind you, it could get in that position when you step forward. So another way this could happen is if you're sitting on a bar stool or a higher surface, your leg is down and you step forward, leaving it behind you. You're allowed to take normal steps forward, that's fine. Just avoid leg really far behind you and rotate it out. One of your hip precautions for life is to avoid hip flexion and internal rotation. So, bending your hip and rotating it inward. This can occur if you're sitting in a chair and you go to reach for something and your hip rotates inward while it's bent. Another way this can happen is if you're sitting here and you go to pull the heel of your shoe on and you're bent and your knee is rotated in at the same time. Another way that this can happen is if you're shaving and your leg is up and you rotate your leg to reach everywhere. So you need to do the best you can to avoid the extreme of hip flexion and internal rotation. The proper posture for getting up from a chair is to extend your surgical leg, scoot forward, keep it extended, stand up. This way, if you have precautions to not bend more than 90, you're avoiding that. When you're going from sit to stand using crutches, it's a good idea to grab hold like you've got a cane. Still, you need to scoot yourself forward, keep your leg extended, grab onto the seat or the arm of a chair, grab onto the crutches, and stand up. You can also do it with the crutches in your other hand, whichever is comfortable for you, just so long as you don't rotate your hip or get into any of the positions that we've told you to avoid. Some patients will have a posterior surgical approach and require additional specific dislocation precautions for about 6 to 12 weeks after surgery. They'll maintain these precautions until cleared by their physician, and then they will do general lifetime precautions. The posterior precautions are no crossing your leg. So when you're sitting there, don't cross your legs. Also, you want to avoid rotating your leg inward, so watch that rotation. You also, when you're sitting, to get a better angle at this, when you're sitting in a chair, you want to make sure that you are at least 90 degrees. Don't bend more than 90 degrees, so keep that nice and open. When it comes to putting on your pants or underwear, you can grab your pants from the waist to the leg hole, grab onto your reacher, lower it down to your foot. You can kind of rest your foot on your heel if you need to get it started. Kind of get your toes so they're showing, and then depending on if you're right-handed or left-handed, you may have to switch the reacher around a little bit. Just grab them up to where you can reach them with your hand. Then you can grab the other side of your pants, either bunch the leg up or just lower your pants down. Get your legs started. Get it up to where you can reach them. Get them up nice from those feet, up high enough so that when you stand, you can get your leg extended in front of you. Stand up. Grab your pants, pull them on. And to get your pants back off, just kind of pull them down, but keep them high enough that you can stick your leg out in front of you. Sit down. You can use gravity to help a little bit. Grab that reacher, push them off of your non-surgical leg first, and then you can pay attention to the leg that was operated on. Get that out, and there you go. During your hospital stay, an occupational therapist will come and see you for 1 to 2 visits to address self-care, how to do things at home within the limits of your precautions. One of the things that they will do is they'll talk to you about adaptive equipment that you can use for lower body dressing. This is a sock aid. You can use this for different length socks. One example is even this small ankle sock. You can get it on here, grab it on there, hold on to the handles, toss it out in front of you, point your toe, and pull. You can do all of that without bending past 90. You don't have to bend down to that foot. If the sock is a little crooked on your foot, you can grab your reacher. You can go down there and kind of tug it on. You can also use the reacher to get the sock off. Grab onto that, get it off like that. I'm going to show you with a longer sock, and just kind of remind you, when you're putting the sock on there, hold it against your stomach. Don't try to squeeze it with your knees. So just kind of get that sock nice and snug on the toes. Grab onto there. Grab a handle. Make sure you're not bending more than 90 if that's one of your precautions. Toss it out in front. If you're having some trouble lifting your leg, you can lift your toes up, kind of get it started, and then just push to kind of lift your foot up off the ground. When it comes to getting your tennis shoes on, you can use a reacher to grab your tennis shoes that have elastic shoelaces in them. Use a shoehorn, back of your shoe, watch your body mechanics. Now slip that foot in there, and then you can use the reacher to push your shoe back off. You can also use a dressing stick, this hooked end, to get your shoe off. Just slide it inside the back of the shoe. Closest to the heel is the best. And push the foot out. Always watching your body mechanics. After hip surgery, some people have difficulty reaching to wipe and still maintaining their precautions. One option is to use a toilet aid. You can wrap the toilet paper around it, reach back, wipe, and then drop it in the toilet. Another option is you can just bunch the toilet paper on there, wipe, and drop it in the toilet. And then you can clean them with a disinfectant.